Hello and welcome to the first episode of the Marvellous History of Medicine podcast. In today's episode, we'll explore that weird and wonderful time in the late 19th century when doctors attempted to swap milk for blood. Okay, close your eyes and think back, way before you were born in fact. Take yourself all the way back to 1855. Transport yourself to Ohio, USA. Reach out for the newspaper. That'll probably be the Ashford Union. Flick through until you find a title called Medicine and Surgery, and allow me to read on for you. Dr. James Bovell has published a communication on the transfusion of milk as a substitute for blood in a cholera epidemic outbreak in Toronto. Yes, you read that right. In the middle of the 19th century, doctors experimented with directly injecting milk into our bloodstreams to replace blood on the premise that it was nutrient-rich and that the oily, fatty component of the milk would hopefully be transformed into white blood cells. Now let us see how the intrepid Dr. Bovell fared with his attempts to treat those poor souls suffering from cholera, and now a shot of milk right into the veins. The newspaper article continues to say, chemical mixtures to resemble blood had been tried in England, but these lacked the impress of vitality. Milk, on the other hand, while closely allied to blood, has this connection with life, and has been used in a number of cases of collapsed patients with great benefit. This, however, turned out not to be true, because, as is common knowledge now in the age of microscopes, and really ever since blood typing in 1901, we now know that milk and blood are not mutually exchangeable or compatible, because milk lacks almost all of what is useful in blood. And those fats cannot be directly converted into white blood cells. So, let us jump forward to 1879 and to the write-up of a case report by a Dr. Joseph Howe at Bellevue Hospital Medical College in New York, and his experiments with milk. Dr. Joseph Howe writes as follows: since my first experiments in the transfusion of milk, many attempts have been made in this country and in Europe to popularize the operation. Some have found it useful, while others, like myself, consider it a dangerous operation, and one which in no degree possesses the value of blood transfusion. Notwithstanding my unfavorable views of the operation, I experimented last year with human milk, thinking that it might possibly possess superior advantages to the milk of cows and goats. The history of the case given below shows conclusively that human milk is no better than milk obtained from any other animal, and that the same unfavorable and alarming symptoms attend its use. Louisa Rade, 25 years old, a native of Italy, was admitted to Charity Hospital on February 17th, 1879, suffering from caries of the first and second ribs on the right side, caries of the first dorsal vertebrae, and chronic catarrhal enteritis. 2 large abscesses communicated with the diseased bone and discharged large quantities of fetid pus. Tonics and stimulants were given with good effect for a few days. Her appetite increased and the suppuration diminished. This improvement, however, was only temporary. She soon began to sink from the combined effects of profuse diarrhea and suppuration. It was then decided to try the intravenous injection of human milk. A healthy woman was obtained from the lying-in ward of Charity Hospital. 3 ounces of healthy milk were drawn from her breasts, strained through carbolized gauze, and placed in a basin of warm water. The cephalic vein in the right arm of the patient was then opened, and the double cannula of the Collins instrument introduced. The milk was then poured into the receiver, and the injection commenced. At this time, the patient's pulse was 126, and her respirations 22. When the first half ounce had been thrown in, the pulse ran up to 150, and the respiratory movements to 30 to the minute. She complained, through an interpreter, of great pain in the back and limbs, which I've noticed before in other cases of milk transfusion. With the introduction of the next half ounce of milk, the respiratory movements became laboured and irregular, the pulse intermittent and at times almost imperceptible. The operation was temporarily suspended until these unfavourable symptoms had disappeared, and then another ounce was slowly injected. Howie is nothing but a trier. The respiratory movements then ceased altogether. and no pulse could be felt at the wrist. The cannula was drawn from the vein, and artificial respiration produced immediately. In the course of 5 minutes of active effort, the pulse and respiration returned to an extent sufficient to warrant the removal of the patient from the amphitheatre to the ward, where hypodermic injections of whiskey and morphine temporarily restored her lost vitality. The effect of the milk injection was so well marked and sudden, and the prostration so complete, that all present at the operation expected a fatal termination, but were happily disappointed. The patient lived 10 days after the operation. Her post-mortem examination showed catarrhal pneumonia at the apex of the right lung, ulcerations in the large and small intestines, with extensive necrosis of the bones previously mentioned. There were, however, no lesions referable to the intravenous injection of milk. That was Dr. Howie in 1879, and as we can see from his findings and those of the other doctors publishing at the time, the hopes claimed in that 1855 edition of the Ashland Union that milk transfusion could be an effective substitute for blood turned out to be more than a little bit off base. As for what else was going on in the Ohio medical scene back in 1855, well, that same edition of that same paper, the Ashland Union, goes on to discuss at length the vitality and vigor benefits of mixing arsenic with tobacco to strengthen the lungs and legs for physical exertion, both of which we now know to be extremely toxic substances. Not medicine nor Dr. James Bovell's finest hour. So let us move on from the darkness of milk to the light of poetry. Specifically, to finish today's episode, let's enjoy a poem from that same 1855 edition of the Ashland Union. It's called 2 Years Old and was written by a Mrs. Bradley. 2 years old. Is there on this cold, selfish earth one heart so cruel as to scold a roguish boy brimful of mirth, and like my pet, just 2 years old, for fun and mischief seemed to leap through his blue eyes from Robbie's heart, as from a barbel's chalice deep the half-imprisoned sunbeams dart. I got a switch the other day, just half inclined to whip my pet, but on the mantle slowed away. That switch unused is lying yet, for when I shook it o'er his head, he danced about, half wild with glee, then quick behind the table fled, and feigning fear, peeped out at me. What could I do but laugh at that? Nor did my fit of laughter fail to make him worse, for to the cat he sneaked and pulled her long, sleek tail, until poor pussy mewed aloud, and then I shook the switch once more, and many whippings inly vowed, for little Rob was still in store. But when I cried with half a frown, "You'll hurt the cat, you naughty boy," he hugged her up and soothed her down, until poor pussy purred with joy, for love through all his mischief flows, and gentle feelings softly beam through his wild mirth like some sweet rose, reflecting from a gushing stream. From morning's dawn till set of sun, his feet and fingers never tire. He steals the poker for a gun, and takes the broom to poke the fire. Then with a cunning look he'll stand upon the highest chair in reach, and shouting loud with outstretched hands, pretend to make a mighty speech. In every nook or corner sly his roguish eye is sure to peep, and Grandma's pocket he will try to fathom, be it ever so deep. He pulls the buttons off my dress, and then says, "Look, my pretty boy, when I might scold I pause to bless thy upturned face so full of joy." His father's hat he loves to wear, and hiding half his tiny head, a glow of beauty rich and rare upon that old black hat is shed. For 'neath its brim, so dark and deep, his dimpled face, all bright with bloom, peeps out as rosy vapours peep, sometimes from clouds of wintry gloom. He'll slyly pull his brother's hair, or steal their toys and run to me, but when they gather round in prayer, he too will bend his little knee. And though he scarce can speak a word, there's worship in his speaking eye, and Robbie's prayer I know is heard when he looks up to God's blue sky. So that's it for today's episode. If you have been, thank you for listening. Please consider dropping us a like or a subscribe or whatever makes sense on the platform you've found us on. Until the next time, be well and stay healthy. And don't, whatever you feel like doing, inject milk.